Today is November the 1st, 2020. It is 13, I'm in the 1300th hour. We have an election in 2 days. I'd love to talk about that, but I think everybody's pretty much made up their mind. I have a lot to say about that, but at this point, what's the point? But what I want to touch on today is everybody's favorite subject of COVID. Let's talk a little bit about COVID. I just saw some stuff today where we had record numbers, all of us, a record number of cases. Let's address this. I've met people that are terrified of getting this. I mean, terrified. I think you should be concerned. I mean, every flu season, I really didn't think too much of it, but I know somebody I know somebody who died at like 40 years old just with a case of the flu. He was a perfectly healthy person, and he died from the flu. And I found that out about 2 years ago, and it was kind of an eye-opening thing because you never really. I mean, how many people do you know that died from the flu? Perfectly healthy young man, he gets the flu, he wasn't feeling well, goes to the hospital, they go, oh, you got a case of the flu, nothing we can do. We're going to just try to hydrate you and, give you a few things, and ends up dying. But this is what I want to touch on. I live in Illinois. The state has been locked down since April or March. The economy is destroyed. Chicago is a ghost town. People are out of work. Every restaurant is going to end up. I don't see. There are so many businesses I don't see coming back. And there's another unforeseen thing that some of you might not be thinking of. All these companies that have offices that pay millions of dollars in office rental space and so on and so forth in our large cities, they figured out that we don't need to keep these spaces because we have figured out a way to make everybody work productively from home. And it is going to cause a real estate glut in a sense that we've never seen before. There's a lot of social ramifications from this, but I want to touch on this. I am not a microbiologist. I'm not a disease infection specialist. I'm not in the healthcare industry. But you know what? I know a little bit more about pathogens and viruses and bacteria and protozoans and diseases than most people. Why do I know this? Well, because I've kept animals my whole life. And I've learned certain things about what you have to do to keep them healthy. And I know actually quite a bit about viruses. I know quite a bit about bacterium. I know quite a bit about protozoans and protozoan-borne diseases. It's a whole other spectrum of things that you just never hear of. And human beings do get some of these. But what I want to talk about is something very simple. Here is a mask. I got a little secret. I've been wearing this one for months. It is probably the most contaminated, filthy, disgusting thing that you will ever know about. Now, does anybody else know? No. When I put this on in a store, does anybody know? No. But they see it and they say, oh, he's complying. Everything's safe. I've been breathing on this thing forever. Right? And this is what happens. Because I'm working, I'm an essential worker. This is what happens. Let me put this on. I'm in the store. It's fogging up my glasses. I can't see. Look at my hand. I pull it down. So now I can see. And I pull my glasses up. Oh, my lovely contaminated mask. Oh, look what I have here. I've got a pen. I'm right-handed. Oh, here's the pen. Let me sign the credit card receipt. Here you go. I just transmitted every single germ on this mask to the pen, to that credit card receipt that the person goes and grabs. I just contaminated that whole place. Everybody that woman touches, or a man touches, the cashier touches, I just contaminated everything. So here we are. Everybody's all worried. Everybody's concerned about disease. Wear your mask, wear your mask, wear your mask. Wash your hands, wash your hands, wash your hands. I carry hand sanitizer. I use it every chance I get. But the point is, that's me. If I'm doing this with the mask, how many people else are? How many people are touching their face, touching a pen? You know, here's another thing. Here's a clipboard that I use for work. I hand this to somebody. They are grabbing my pen, which is contaminated with the germs on the mask, and they're signing their name, and they were touching my pen. How many other people are doing this? Seriously, think about this. How many other people are doing this? How many other people are touching pens, touching doorknobs, touching handles? Every time you go into a door and you're touching it, every time you go to a bathroom and you're touching it, every time you're doing it, unless you're using your shoulder or something. But the point is, everybody's been wearing a mask, at least in Illinois, since March. The cases are going up. Now, there's another reason for that. They got a lot more widespread testing. I've had 3 eye surgeries on this eye since July. And every time I go in, they test me for COVID antibodies. My antibodies are supposed to only be good, they say, the CDC says, for 3 months, 4 months. First time I go in, I test positive for antibodies. The nurses were all excited because you're the first person that came in here and tested. We thought something was wrong with the test because we all know we had it back in February. We all suspect we had it, but we're not showing up on these tests. I go back for my next eye surgery. I test negative. And they said, and they all remember who I was. And they said, we saw your name. And we were wondering if you were still going to test positive. I guess the CDC rules are fine. 2 months. Yeah. About 2 months after that. No, about 2 weeks after I get that. I'm back getting another eye surgery. They test me for COVID antibodies again. I test positive. The same nurses, couldn't believe it. And they go, this can't be right. They test me again. So they give me 2 tests in a row just because they just didn't believe it. So now they think that I was infected a second time. Now, I don't know how I was infected a second time because I haven't gone anywhere. I've been laying on my face for 2 weeks. Seriously, I've been laying on my face. If you had retina detachment surgery, you know what's going on. I'm not leaving my bed, more or less. I'm laying on my face for 2 weeks. How the hell did I get infected a second time? Laying on my bed for 2 weeks. But that's what they think. They think I got infected twice. Because they don't believe the results of this. So regardless of this, either that or I'm a freak in nature and I've got antibodies for 6 months. If I really felt like spending the money, I get myself tested for antibodies next month or next week just to see if I have it again. And they got the test results back in about 15 minutes. So the point is this. All of you out there, and I'm not saying you shouldn't take precautions, and I'm not saying it's not serious. Chickenpox kills people, believe it or not. You were never brought up to believe that, but it does kill people. You have been taught that mumps will do something to you, and I had the mumps when I was a kid. I ended up with the mumps. I thought I was vaccinated for it. I guess I wasn't, but I ended up with it. Never knew I was even sick. I had some swelling in my lymph nodes. I was in, I think maybe 2nd or 3rd grade. I didn't feel bad at all. I didn't even realize I was sick. Adults knew that your neck was swollen. I had no idea. But I guess for males in particular, a mumps infection can leave you end up being sterile. That's a horrible thing for men, at least. So the point is, and we'll just think of COVID as something flu-like, because the flu is still here. We have a flu season every year. It usually runs from the beginning of winter to the early part of spring across the globe. They anticipate what particular strains are going to be there, and they make a multi-strained vaccine out of chicken eggs, and then they distribute it thinking this is what we think is going to be the strain for this season. It doesn't necessarily mean it is. I no longer get flu shots because the last time I got a flu shot, I was sick as hell. Now, I'm going to tell you outright, I've had COVID and I've had the flu. If I react to COVID every time, if I react to COVID the same as I did last time, I will take COVID over the flu any day. COVID did not disrupt my life in the sense of anything I did outside of cutting my grass. I felt normal, except for I did feel tired at the end of the day. And as far as doing something, like cutting an acre of grass with a push mower, which probably anybody listening to that doesn't do anything like that, but I do. I wouldn't have noticed it. So, and if I cut it a second time just laying around, I don't even know what to say. Now, there's plenty of people, and I will promise you there's plenty of people that had it and didn't know they had it. So I am willing to bet that there are a lot more people in this country, in the United States of America, that had COVID and don't realize it. And I don't know if you went out to get tested for COVID. I don't know where it is in the state you're in, but let me tell you something. Back in May or June, when I was trying to get tested so I can go back to work, what a nightmare that was. And I didn't say anything about this. I went to 4 different test sites because I was not going to go and spend $250 to get a test to know that I already had it. I already knew I had it. I just wanted a negative test so I can go back to work with the paperwork, right? I went to 4 different places that were testing for free. The testing was supposed to start at 9 o'clock. I get there at 9 o'clock. They have police out there to tell you, we're all done. You got to go home for the day. I said, what do you mean go home for the day? Well, they're only allotted 500 test kits, and they're already done. And there's people lining up here at 5 o'clock in the morning. That was back in June. Now, I'm guessing they're doing better. Some of these places are still having tests. I went past a test facility the other day, and they got a lot more tests now. By many different companies are making them, and maybe they're better tests, too. And truth be told, there's probably a lot more people testing positive. There's people probably going on, and here's another thing. In order for me to get tested, you have to go online. Back when I was doing it, you had to go online and fill out a questionnaire to get an appointment to get a test, to get a free test. And I kept failing it because I would fill out the questionnaire honestly, and they would say, stay home, self-isolate, or go to the emergency room. I need a test to get the hell back home. I haven't worked in a month. I'll get back to work. I haven't worked in a month. I'm not going to spend $200 for a test. So I lied. And they never verified whether I was telling the truth or not when I got to the test station. I lied and I said I was in the healthcare field. For all they knew, I was a doctor or a nurse. They had no idea. And just because I lied on the online application, it was okay, this is your time, you show up. So that's how I had to do it. I had to do it in a dishonest way just to get a free COVID test. What kind of nonsense is this? So here we are in November with it's still running rampant, despite all these freaking masks that everybody's wearing. And it's a psychological thing. Everybody needs to understand this. This is a psychological thing. This makes people feel safe. That's all it really does. Because truth be told, like I said, if I've been wearing this mask for a month and breathing into it every time I go into a building and putting it on when I have to put it on, the nose bridge is dirty. God knows what kind of pathogens are in this cloth paper thing. I'm not going to go buy a box of them just to wear it because it makes other people feel safe. I'm not. You call me disgusting. I don't care. Look, it's really simple. The organism is here. They still don't know much about it. They're still trying to figure out. We got to